Okay, so this person's complaining that, the laws had nothing to do with these women's deaths and yada, yada, yada. He says here, especially, let's talk about this teenager in Texas. The teenager case was plain and simple malpractice, had nothing to do with the law. Let's look at it. A pregnant teenager died after trying to get care in 3 visits to Texas emergency rooms. It took 20 hours and 3 ER visits before doctors admitted the pregnant 18-year-old to the hospital as her condition worsened. She's one of at least 2 women who died under Texas's abortion ban. Candace Fales screamed for someone in the Texas hospital to help her pregnant daughter. Do something, she pleaded, on the morning of October 29, 2023. Nevaeh Crane was crying in pain, too weak to walk, blood staining her thighs. Feverish and vomiting the day of her baby shower, the 18-year-old had gone to 2 different emergency rooms within 12 hours, returning each time worse than before. The first hospital diagnosed her with strep throat without investigating her sharp abdominal cramps. That's malpractice. At the second, she screened positive for sepsis, a life-threatening and fast-moving reaction to an infection, medical records show. But doctors said her 6-month fetus had a heartbeat and that Crane was fine to leave. Now, on Crane's 3rd hospital visit, an obstetrician insisted on 2 ultrasounds to confirm fetal demise, a nurse wrote, before moving her to intensive care. By then, more than 2 hours after her arrival, Crane's blood pressure had plummeted, and a nurse had noted that her lips were blue and dusky. Her organs began failing. Hours later, she was dead. Fales, who would have seen her daughter turn 20 this Friday, still cannot understand why Crane's emergency was not treated like an emergency. But that is what many pregnant women are now facing in states with strict abortion bans, doctors and lawyers have told ProPublica. Pregnant women have become essentially untouchables, said Sarah Rosenbaum, a health law and policy professor emerita at George Washington University. Texas's abortion ban threatens prison time for interventions that end a fetal heartbeat, whether the pregnancy is wanted or not. It includes exceptions for life-threatening conditions, but still, doctors told ProPublica that confusion and fear about the potential legal repercussions are changing the way their colleagues treat pregnant patients with complications. In states with abortion bans, such patients are sometimes bounced between hospitals like hot potatoes, with healthcare providers reluctant to participate in treatment that could attract a prosecutor, doctors told ProPublica. In some cases, medical teams are wasting precious time debating legalities and creating documentation, preparing for the possibility that they'll need to explain their actions to a judge and jury. Dr. Jody Abbott, an associate professor of obstetrics, I can never say that word properly, and gynecology at Boston University School of Medicine, said patients are left wondering, am I being sent home because I really am okay? Or am I being sent home because they're afraid that the solution to what's going on with my pregnancy would be ending the pregnancy, and they're not allowed to do that? This is the problem that you guys don't fucking grasp. You can talk about the exceptions for the life of the mother all you want, but the convoluted nature of these bills and the threat of criminal prosecution, sometimes up to a decade in prison, has caused these doctors to not know what to do and not treat somebody because they hear a heartbeat. Because if they do something to treat the woman and it ends that heartbeat, they're looking at going to prison. Why? Because some fucking shit stain in the state legislature decided that their religious mindset, their religious point of view says that that's a human being inside there, so by God, you can't touch her and end that heartbeat. That's why we're having women die as a result of these laws being passed. You can talk about what's in the laws all day long. The effect of the law is being seen with actual casualties.